Hello, everyone. Thanks for having me in your health talks during your annual conference. I'm Ezequiel Garci a-Elorrio from Buenos Aires, from the Institute of Clinical Effectiveness and Health Policy and ISQua. It's a pleasure to share this time with you, and hopefully some ideas could inspire you along the conference that's going on. Thank you. Latin America has been hit very hard by the pandemic. You know that from the papers and different sources, and we have been doing nothing like good because of weak health systems that showed that weren't prepared for what happened, and hopefully we can learn from that for future situations. The thing is that the region is very unequal. So whatever you can do of delivering evidence-based interventions in unreceptive settings, that of course will not change things. And I wish that politicians and especially society could learn from this for the future. The thing is that, of course, we have the same guys as you are back in Canada that do not like vaccines, the use of masks, and not being driven by science. Vaccines are rolling out very slowly in the region, so there's a long way for us to go in terms of the pandemic. So there are still challenges that are present. So the thing is that whenever we started working, trying to support providers during the pandemic and health systems, we focus on health providers because resources are not enough, having enough ventilators or bed units, have enough people that are working the right way to provide the right care for patients. So the story I'd like to share with you briefly is the story of Sylvie Coffret, a nurse who died in early May because of COVID, and his death promoted the sanction of a law that states that PPE should be provided for health providers. You don't need a law for that, but eventually that led for us to think how we can support staff during the pandemic, and the World Health Organization stated that these were the critical resource to be strengthened along the pandemic and along the care that providing critical care units to patients. So we thought and envisioned a project I'd like to share with you. This project wanted to be based on a learning collaborative in 15 units, ICU units in Argentina, trying to, in the public sector, protecting staff to be available for patients and to provide the best use of resources, especially ICU beds. The thing is that we envision this project in human factors and ergonomics, delivering and deploying a number of interventions that supported health systems in the most critical resource outside Buenos Aires, the capital city, because ICU beds are kind of scarce in many regions of our country. So we promoted proper use of PPE, trying to prevent overusage or underusage, because as I said before, the availability of those were low. They're still low, so we need to use them appropriately to prevent the transmissions to providers. Also, the case of emotional support was very important for us. So we identify an Spaniard digital solution with health providers to be screened and supported for mental conditions that may happen during the stress providing care in ICUs. That's being tested too now. We also, you're familiar with Team Steps from AHRQ in the US, because CPSI is using it to improve patient safety through improving communication and teamwork, and eventually more effective care for patients during the pandemic or other conditions. The other thing that we thought was important is to provide empathic care to patients, to improve well-being of providers, because the coldness of the first steps of the hospitals that were closed for families during the first stages of the pandemic, eventually that changed, that improved, and make patients and family in the need of being more empowered. And that's our fifth intervention, because there's a very good systematic review on the importance of empowering patients to improve care. And that was another component of our intervention that was supplemented and ended with the usage of a checklist that's coming up, where this checklist is being used, you might be familiar with this, to trying to deliver the right care to prevent adverse events. And those adverse events may affect the flow of patients in the ICU and making resources less available. So it was another test of concept that hopefully will deliver the right results. Which are those results? To have more available staff, more motivated staff, more empathic staff, and more available beds. And from this, I'm trying to go back to my hopes for healthcare in the future, hope that we have learned what we have been suffering during the pandemic and which were the important things to be taken care of, and the importance of collaboration. And that's what I find takes for the future. This is a small postage on the things translated to Portuguese to be used in Brazil, about the tools that we have been sharing with you now, and try to improve teamwork in different settings that happen all out Brazil for their government that we have been collaborating with. Because for 21st, what we want is a more transparent health systems, data-driven, evidence-based driven, and mainly collaborative, because there's a lot to learn among each others, especially in regions of the world that share the same needs and same challenges. Finally, I'd like to share with you the concept of the call to action that we provide from Latin America, just to share again the power of collaboration among people we share with that, sorry, to keep repeating, share, that have the same faces, the same challenges. And there was a number of interventions that hopefully you will find of interest if you would like to see those. The world changed forever. Here you see a face mask, Cristo Redentor in top of Brazil, in Rio de Janeiro. So we should learn from this. Hopefully that happens. We'll see. And again, a pleasure to share this time with you. It's challenging to provide a picture kuka in English. So hopefully it's understandable for you, and you have my email for future contacts if you need it. And my pleasure again, and thanks for the invitation. Bye-bye.